A broken finger, medically known as a finger fracture, happens when one or more of the bones in the finger cracks or breaks. The human hand contains 14 finger bones, called phalanges. Each finger has 3 bones, proximal, middle, and distal phalanges, while the thumb has 2. A fracture can occur in any part of these bones, depending on the type and severity of the trauma. Finger fractures are quite common, accounting for a significant portion of hand injuries. They can happen to anyone, regardless of age or occupation, though they're particularly prevalent in certain groups, such as athletes. Types of finger fractures. Finger fractures come in several different forms, each requiring a different approach to treatment. Here are some common types of fractures. Number 1. Stable fracture. The bone is cracked but remains in its proper alignment. These fractures are usually easier to treat and heal faster with minimal intervention. Number 2. Displaced fracture. The bone breaks and shifts out of alignment. This type of fracture may require manipulation or surgery to realign the bone. Number 3. Open or compound fracture. The broken bone pierces through the skin, creating an open wound. These fractures are more serious and carry a higher risk of infection, so immediate medical care is crucial. Number 4. Comminuted fracture. The bone shatters into 3 or more pieces. Comminuted fractures are often the result of severe trauma and may require surgery for proper healing. Causes of a broken finger. One of the most common causes is direct trauma or excessive force to the finger. This can occur when a finger gets caught in a door, hit by a hard object, or crushed under a heavy item. Sports-related injuries are another frequent cause, particularly in ball games, where fingers can be jammed by a fast-moving ball or collisions with other players. Falls are another significant cause of broken fingers. When someone falls, it's a natural instinct to try to break the fall with outstretched hands, which can lead to finger fractures. This is especially common in older adults who may have balance issues or in icy conditions where falls are more likely. Workplace accidents also contribute to a substantial number of finger fractures. This is particularly true in industries involving machinery or heavy equipment. A moment of inattention or a malfunction can result in a finger getting caught or crushed, leading to a break. In some cases, underlying medical conditions can increase the risk of broken fingers. Osteoporosis, which is a condition that weakens bones, makes them more susceptible to fractures, even from relatively minor impacts. Similarly, certain genetic disorders that affect bone strength can predispose individuals to finger fractures. Symptoms of a broken finger. The symptoms of a broken finger can vary depending on the severity and location of the fracture. Pain is usually the most immediate and noticeable symptom. This pain is often intense and sharp, especially when trying to move the affected finger or when pressure is applied to it. The pain may be constant or may worsen with movement. Swelling is another common symptom that typically appears shortly after the injury. The finger may become noticeably larger than normal, and this swelling can extend to surrounding areas of the hand. Along with swelling, bruising often occurs. This can range from mild discoloration to extensive bruising that spreads across the finger and into the hand. Many people with a broken finger describe a feeling of stiffness or inability to move the finger normally. In some cases, the finger may appear deformed or bent at an unusual angle. This is particularly noticeable in more severe fractures or those involving joints. Some individuals report a grinding or grating sensation when trying to move the broken finger. This sensation, known medically as crepitus, occurs when the broken bone ends rub against each other. It's important to note that not all broken fingers will exhibit all these symptoms, and the severity can vary greatly from person to person. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of a broken finger. Diagnosing a broken finger typically involves a combination of physical examination and imaging tests. When a patient presents with a suspected broken finger, the doctor will examine the finger for signs of deformity, swelling, bruising, and tenderness. They also will gently palpate or feel the finger to assess pain levels and identify areas of tenderness. They may ask you to try moving the finger to assess the range of motion and pain. While a physical examination can provide valuable information, imaging tests are usually necessary to confirm the diagnosis and determine the exact nature and location of the fracture. X-rays are the most common and often the only imaging test needed for diagnosing a broken finger. X-rays provide clear images of bone structures, allowing doctors to see the fracture's location, type, and severity. In some complex cases, additional imaging tests might be required. Computed tomography scans can provide more detailed 3D images of the bone and surrounding tissues, which can be particularly useful in planning treatment for complicated fractures. Treatment for a broken finger. The treatment of a broken finger depends on the type and severity of the fracture. In most cases, the goal is to realign the bone and immobilize the finger to allow it to heal properly. Here are the common treatment options. Number 1. Immobilization. For stable fractures, the doctor may simply immobilize the finger using a splint or cast. Immobilization keeps the bone in place and prevents further injury while it heals. The splint or cast is usually worn for 3 to 6 weeks, depending on the severity of the fracture. Number 2. Buddy taping. In less severe fractures, the doctor may tape the injured finger to an adjacent finger, providing support and stability while allowing some movement. Number 3. Closed reduction. If the bone is displaced but hasn't pierced the skin, the doctor may perform a closed reduction. This involves manually realigning the bone without surgery. Once the bone is in place, the finger is immobilized in a splint or cast. Number 4. Surgery. In cases of severe fractures, such as open fractures or comminuted fractures, surgery may be necessary. During surgery, the doctor may use pins, screws, or plates to hold the bone fragments together while they heal. Surgery is typically followed by a period of immobilization and physical therapy. Number 5. Pain management. Over-the-counter pain medications like ibuprofen or acetaminophen can help manage the pain and reduce swelling. In more severe cases, the doctor may prescribe stronger pain relievers. Home remedies for a broken finger. While it's always important to see a doctor for a broken finger, especially if it's severe or misaligned, there are some home remedies that can help manage pain and support healing in the early stages. Number 1. Ice the finger. Applying ice to the injured finger for 15 to 20 minutes every 1 to 2 hours can reduce swelling and pain. Be sure to wrap the ice in a cloth or towel to avoid direct contact with the skin, which can cause frostbite. Number 2. Elevate the finger. Keeping the injured finger elevated above heart level can help reduce swelling. Propping it up on pillows, especially when sleeping or resting, can make this more comfortable. Number 3. Rest and immobilize. Avoid moving the broken finger as much as possible. Use a splint or tape it to an adjacent finger to keep it stabilized. This helps prevent further injury and supports the healing process. Number 4. Keep it clean and dry. If your finger is in a splint or wrapped, ensure that the area stays clean and dry to prevent infection. Changing the dressing and checking for signs of infection, such as increased redness, warmth, or pus, is important. Number 5. Gentle exercises after healing. Once the bone starts to heal and under your doctor's guidance, gentle finger stretches and exercises can help restore range of motion and prevent stiffness. Don't rush into this, though, as doing it too early can cause more damage. The recovery time for a broken finger varies depending on the severity of the fracture and the treatment method used. Minor fractures might heal in as little as 3 to 4 weeks, while more complex breaks can take 6 to 8 weeks or longer. It's important to follow the doctor's instructions carefully during recovery to avoid complications such as stiffness, loss of motion, or improper healing. Now, we want to hear from you. Have you ever experienced a broken finger or a similar hand injury? How did it affect your daily routine, and what helped you recover the most? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.